So we come into the space. If we have had to navigate like doors and stuff like that, then we need to immediately sanitize. Okay? And we grab our lovely bolster and then feet up for me, please. Bolster under ankles. And then I can immediately tell I'm in the right plane with that if I contact the heels, and the bolster should be more or less right in line with their calcaneus is whatever, but their heels. And then going right here to a contact with the low back, so ankles, knees, low back, mid back, upper back, there we go. Contact over the sheet. Here we're going to work with draping. The biggest trick here is to gather and create a roll as well as pull toward your hands. We want it to pull toward their body so that it's hugging the outsides of their body. So not just a roll down, but a pull toward. Okay? And we'll start right here. And that's where we'll practice some of this body mechanic stuff. We're working just between the scapulas, one hand one way, one hand the other way, feeling how each side moves. See how if I take a really far step this way, and I'm lined up in that direction, wherever my nose is pointed. Okay. Round. Just moving the skin, keeping everything light. And then I'm going to reposition the arm. So in our sequence, you'll see how that's going to blur. Some of these things are going to blur together. 1 and 2 might kind of blur. All right. Lotion. On that lotion bottle, this is just 2 pumps, and that usually gets me enough for this entire side of the back. And then as I apply the lotion again, that's where I'll kind of throw in these long, swoopy, like pretty applications that pretty much their only purpose is to distribute the lotion, or I could argue to warm up that first layer of superficial fascia. Okay, I get myself set. I'm gonna do a pressure check-in.
Yep.
Okay, just right. A little bit more, a little bit less.
That's good.
Okay, great. And then I just confirm that. And then change my orientation angle. I mean, these are subtle. Usually it's like taking a small step further back and then getting that glide. That's maybe a little sticky. Would you want a little more lotion, or is that about right?
No, that's okay.
Okay. So there's 1, and I'm going to do 1 with a little bit more pressure. I'm just following right along that iliac crest. Okay. Step up. We could do 2 things. You could knead and work this area, knead, and then compression glide, then knead, compression glide, all that. I tend to think more regionally. I'm like, okay, the back was what was going to be worked on, so the whole back was needed to start. So everything's warmed up. So then all I have to worry about now is compressions and glides. So, I'm gonna just, this whole first side I'm gonna be real thorough and just checking out. So pressure, it's just right. Okay. Then turn that into a glide. Real slow, wrist relaxed. Another glide. Partly to keep myself like sped up, I'm gonna really be doing just 2. Now, if it's too slippery, then I couldn't control that. It would go much faster. Right now I'm here. to this upper thoracic scapular region. Arm off to the side. The arm off to the side of the table is going to really open that space up for you, whether it be the upper trap space or between the spine and the scapula. So at the very least, even if a person, or if you don't want to have their arm up over their head, off to the side is really valuable here. Now, with that repositioning, my left hand, I'm on the right side of the body. So my left hand now can just hold the arm. And if it's holding it in a way like, I'm a little bit by the shoulder, I'm up on deltoid, I can hold a spot that feels like massage, but this is not going to be my working hand. I'm going to switch my feet now, and then I'm going to use this forearm. So I use my left forearm for the low back and the lower thoracic area. Now I'm going to use my right forearm for the between the scapula and the spine. All right, pressure. And I turn that into a glide. Little steps as I make this glide occur. Now I'm making tiny adjustments. All one long glide, but really watch that my shoulder angle didn't change at all. It's my whole body moving. Now I'm changing where I start a little bit. I'm a little bit higher up, more on upper trapezius. Pressure. Okay. Take my little step, got my momentum, and then getting it to glide. And doing this, I'll try to keep it exciting, but the truth is I want all of you to, as you're laying there as the client, realize how good a very slow application at the right pressure is. And it doesn't have to be fast, okay? And that's the really most important thing I can tell you. One, for your body mechanics, and you're using your body as efficiently as possible, but also long-term in terms of just how you can argue for creating as much benefit as possible. The slower the application, the more you are truly challenging a muscle to reduce in tone. Pressure has to be stable and consistent and be held for a long duration. That's what truly causes inhibitory pressure. So we have to not work on muscles fast and abruptly. That will be more stimulatory. It might feel good. There are some areas of the body where, the thumb actions, like on levator scapula, by the scapula, that stuff has a sensation to it, but it is not the application that's going to actually cause the change in the tissue as effectively. From a connective tissue standpoint as well, if I can at least have some change of shape on that skin and be tugging the superficial fascia in a few directions each time, I'm also getting more benefit related to the specific texture and quality of the fascia, but also there's going to be a lot of returning to the benefits of lymphatic drain. And if we're mobilizing the superficial fascia, making sure it's pliable, you're going to be influencing the lymphatic system. All right, upper arm. Here I'm going to use my hands more. I could use forearms for the limbs and stuff, but a lot of times there's some areas where I'm conditioned to changing up how I use my body. So this one I stand still to the side of the table. I didn't change where I was too much. I was here using this arm. I just switched my feet and turned that into my push hand now. So compression. And I'm starting to feel confident now, so I don't have to keep on bugging, right? Pressure's still good. Mm-hmm. Yeah. And then it's turning into a glide all on its own. Switch my hands. Now this hand can just kind of stabilize and kind of pre-pull the tissue. With kneading, you do not have to be too aggressively causing this torsion, okay? A lot of times if you just fix and stabilize the tissue with one hand and focus on pushing and just causing a glide with your other, then the twist, the torsion, the knead will happen by itself. The limbs are much easier to knead than the torso. Okay. And up. We will have days too where we focus more specifically on massage by body region. So we'll have days where we focus more on the limbs, more on the torso, all of that. Right now I want to focus as much on just an efficient process of like working your way, getting through the body and using all the applications. So I warmed everything up, did some small kneads here. You'll see it better on the other side. Switching my feet, slowly graduating the pressure, warmed everything up. I'm going to need just a little bit of lotion. Here, now this is a place where I do switch to a forearm. My really preferred tactic is to use my forearm like this. It's the one where I swap, where my hand is going to go across the table, it's going to go away from the table. I can plant my forearm right on their forearm, just below, just inferior to their elbow. And then here's where I can apply plenty of pressure and work my way towards the hand. Now, as we do this, I mostly show this because it can be beneficial for your golfer's elbow, tennis elbow, as well as carpal tunnel stuff. To approximate the tissues towards the palm, towards the wrist, tends to be the better tactic here, unless it's about a fluid movement thing. If they have swelling, then yeah, the forces need to go towards the torso. For a lot of other stuff related to the forearm, elbow, and hand, better to start at the elbow and work towards the wrist. Now, as soon as those fingers start curling, I need to start lightening my pressure up. I don't need to completely take the pressure away, but if you start by the elbow and you're more on the meat of the forearm, the fingers will open up. And as you move closer to the wrist, the fingers will start curling. That's because you're starting to push on the tendons. And you just want to reduce the pressure a little bit. And then we're good. One of my tricks tends to be if I apply a little pressure on the bulk of the muscles closer to the elbow, that will open the fingers up. And then it's how I can place my soft fist right there. And then I cradle, I protect the joint of the thumb with one hand. And I'm just going to use a soft fist application all through the palm. The group of muscles in the pad of the thumb are the thenar muscles. And there are quite a few there. The thumb can do a lot of stuff. It has a lot of extra muscles, so that area deserves some extra attention. And if I kind of just hold that thumb with one hand and continue to use my soft fist, and I line my knuckles up with each digit, now I'm going to be working along, not just influencing the carpals, but also the metacarpals. And I keep on going all the way out. It's technically, we're moving lateral to medial. The pinky side of the hand would be medial. But the pinky also has a group of muscles called the hypothenar group. So between the two of those, if I influence those, that's a lot of good stuff. It's most of the intrinsic muscles of the hands. And I will save working on the individual fingers for when we get to supine. Now, we have to swoop ourselves all the way around. So client will put you back wherever you're comfortable. Now here, I kept the arm covered. I try to maintain as much coverage as possible, assuming that maybe a person's chilly or at the very least like maintaining modesty, right? My trick for getting around the other side of the table is this big swoop, grabbing hold of the upper trap. And now that we're gonna be contacting the skin, what's nice is this pull action will tend to turn into a glide for you. So you just need to create that sloth claw, but let there be, a bit of a curl with your fingers. You don't want to be too broad and flat. If I did that, I would just fall off. So I have to, the traps, you feel them, they kind of have a shape to them where you can wrap your fingers around. You want to be over on the neck. You want to be just on the other side of the trap. So my fingers tend to be about more like this. And then I just hold that and I pull straight back. So keep your spine straight, bend both knees. If there's a small nuance here, I might stack my fingers, both sets of hands, and push and create a nice pressure sensation as I go back and reset for the pull. So that'll be my push. And then I'll grab hold and pull. It's a good way to change up how you use your body. Get a little bit of a stretch for your shoulders. and it gets me standing all the way over on the other side of the body to start it all over again, okay? Now when draping here, just find the hand, find the arm, find the wrist, move that into position first, then you're good to go. Probably the number one draping snafu that happens, it's not even entirely draping, but inadvertent contact snafu that happens is bumping into or grazing the client's hand when you don't mean to. So identify and find where their hand is first, move that out of the way, and then you're good to go. So, all right. Distributing the lotion. I already had mobilized the skin, superficial fascia some. So here, the needs, do the best you can, but like they don't have to be anything too big. Like again, all of this can be just part of warming up that first layer. Still warming up. Nice up. So there's all those rocks. So I'm just kind of slowly, rhythmically moving. Enough for the whole body turns. Okay. Pressure till it's just right. Okay. I try to just hold that, and I probably, this whole stretch, I won't even check in on that again. I'm going to turn that into a glide. Amount of lotion still good?
Yeah.
And please just let me know at any time. Lotion as well as pressure. Important that it is as comfortable as possible. So 1, 2. In this routine, I'm going to show predominantly working on the low back and this kind of orientation where you're either going across, right towards the spine, or down a little bit on an angle. Just because we're going to save mobilizing the structures here in a different direction, we're going to do that in the sideline. There, I just have to take a step back, start this all over again for the lower thoracic area. Pressure, and then going into my glide. Now that all starts to kind of smear together a bit more effectively. So that was down on an angle, now we're going to go across. And then I'm done. We're going to the next spot, arm off to the side. Stabilize with this hand here. And right now it will be me just kind of confirming my pressure depth based on what I feel. And there it is. It's just right. And I turn that into a glide. So I'm trying to make it more structured. Little steps. That's how you do it, instead of what happens with people is they will get stuck here and then they're using their arm to do the glide, right? So here, and then step, glide, 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 little step, glide, glide, glide. I don't fight super hard to maintain the pressure, but like once you kind of make that step smooth, it happens pretty naturally. There we go. And here to the upper arm. Remember, the only thing you have to worry about here on the arm is if you are working more medially, you have the main artery and nerves coming through there. So as long as your forces are applying themselves pretty much lateral to posterior is what this would be, but the orientation I know is kind of confusing. You're really safe. Mostly being stand by their head, not down by their low back, and you're in safe territory. Okay. Up. Now all I have to do here is I have to adjust things. Hold the elbow. Now I just forgot to do the application with just moving the skin, because there's no lotion here. So all I'm doing now is light glides to warm up that superficial layer. And then I'm going to turn it into a deeper compression that then turns into a glide. Now, my biomechanics now are probably just past the edge of what I would usually suggest for bending forward at the spine. Ideally, the spine stays as straight as possible. I probably typically would suggest for most of you, if I were seeing you working how I am right now, I would tell you to bring the table up at least like one bit. Now, each of you are going to have to make some adaptations one way or the other. I want you to try to start with the table as high as feels comfortable, and then see if you need to navigate and work from there. I tend to, just because I do well with a wider stance, adapt well to a table that's about one notch lower. There's the knees. You'll see pressure here opens the hand up. Soft fist. I'm going to cradle the thumb with the fingers here, and then I can just protect it that way. I'm just not, taking the thumb over into extension too much. So. If I do anything, I really try to line my knuckles up with the long bones. So see how it's in line with the thumb, then it'll be in line with the other fingers. That will create those shear forces into the muscles in between the long bones of the hand, which are responsible for more stuff than we realize. And then as I do this, I'm also mobilizing all the superficial muscles that are like the flexors and extensors. In this case, the flexors of the actual fingers. And good. Then we reset the wrist. So that's all you need to do is tuck the hand in and then come up. Set here as I swoop around, grab hold of the upper trap and balance them out. Good. Now I'm standing right here for working down this side of the lower body. With the draping, remembering not just roll, but gather and pull towards their body. That's a real trick here. Sometimes I have to really pull a lot of the sheet towards me. That way I have a lot of extra bulk to work here. Now for the upper leg, I do not need the sheet to go up really high. I'm going to get a lot of that other stuff in sideline. All right, over here, the first things I'm feeling for, if I just follow the spine down with the kind of edge of my palm, it's pretty impossible to miss the sacrum. So that's what I'm feeling for, right there by the pelvis. And then I'm going to move the hip back and forth. And right now, I want you just getting used to sprinkling this in. Also with first-time clients, it's a time to kind of clarify, okay, we're gonna use the forearm working around the hip area, and I'm just gonna be moving your leg back and forth. They need to, you need to confirm they can actually do the passive motion. Some clients are less capable of allowing for that passive motion than others, so. But also through that, I can be confirming in the future for your assessment skills, how much rotation do they have one way versus the other way. So, thinking gluteus maximus here. For this, as well as gluteus medius, which is a little bit more lateral, just above the hip joint, more on the side of your pelvis. If I turn the leg this way, it will turn the hip, and with the hip, the pelvis laterally a little bit, so it'll turn their body outward towards you. You can get the outside of the hip just a little bit more easily if you, now the direction for the hip here is actually external rotation. Although the foot moved internally, the rotation of the hip is external. This action is internal. So external rotation for gluteus maximus and medius, then we're to those deep lateral hip rotators. So with my forearm, if I just rest my forearm very lightly on the outside of the leg, I can feel for the bone, that greater trochanter, that big bony knob on the outside of the hip. That's for if you need to find it. Like it can be with a hand or even a soft fist palpating. It's like all the way over here. I need to be just posterior and work medial, kind of on a 45-degree angle towards the middle of the table. And that's the one that we practiced where you just good compression, plus if you mobilize the hip this way, I mean, it'll be back and forth, but it's always gonna be more comfortable to start with the foot seemingly lined up with the ceiling and then pull towards you. Okay. At least a couple. Start a little higher up, work a little lower down. We'll get more specific as we go. There are 6 important muscles right here called the deep lateral hip rotators. So in that chart, you should be able to see that under the glutes attaching the greater trochanter to the pelvis, more transversely, the fibers are kind of running side to side, are the deep lateral hip rotators. The most famous one is piriformis, and that one in particular, but all of them are important in relation to sciatica. So, all right, now I just fell into a bad habit and did not. I started applying lotion before contacting the skin. So I just applied a little sanitizer, wipe my hands off on the sheet, everything's good. So here's where I'm going to worry mostly with the legs in prone. I really want to stress that you are going to have a much easier time, and it just makes a lot more common sense to worry about this lateral half of the posterior leg rather than fighting to work on all of it in this position. So up here, what I'm really worried about on the upper leg is basically making sure that the hamstrings and the IT band are unstuck. So I'm just working along that line, and the hamstrings run much more medial. They attach up onto that ischium tuberosity. So I'm warming that up, moving the skin of the lower leg, the calves. The biggest one here is gastrocnemius. Once we get to applying lotion, it's really going to be just this lateral half that I pay attention to. And what this turns into is saving a lot of time in prone position to just work that lateral chunk. And since it runs more medially, the hamstrings, I only need to go about a little bit more than halfway up the leg. We do not need to go much higher, because otherwise you need to come much more medial. So where the sheet is right now is going to be sufficient. It makes the draping easier, all of that, if you just save the time for the rest of the legs for sideline. So that was more on an angle following the fiber direction. Now we're going across. Okay, so with the bone or with the grain of the muscles, starting from the knee, working towards the hip, and then going across, lateral to medial. And I can just stand right here at the knee, though. For those, I step below the knee, so I had somewhere to go. Here, I stand superior above the knee, and then same thing. I tend to, with this hand, it's my non-working arm, so this is I'm on the right leg using my left forearm. I will stabilize their leg with my right arm, as well as with this hand, gather and pull all those calf muscles. Now, otherwise they turn away from you, and you might end up hitting the fibula. So if you just stabilize right there, just inferior to the knee, ends up feeling like kind of more of a counter pressure, like kind of squeeze on both sides of the calf muscles anyway. So this right here starts to look and actually do kneading, even though it's a hand and a forearm. I pulled the tissue forward with this hand, and I'm gliding across, and I'm creating a torsion here, but not with just my hands. It's one palm, one forearm. So down on an angle towards the foot, and then across. And then once we're near the Achilles, I tend to lighten up. I have a little necklace to watch out for. A bracelet, I should say. That's where I would use my palm more, unless they're a giant. I am not going to bother with doing much work on the feet in prone. If you really are stuck in it, then your best position tends to be getting on an angle using soft fists, maybe dropping down so you can work uphill like that. That's all viable, but for time and for a myriad of reasons, side lying is just so much better. However, in this position, one thing that just feels good and is effective is to grab as much of that heel as you can. You should feel like kind of lifting and pulling the tissue away from the underlying bone, just as you kind of create a squeeze. If I'm identifying a few things like that's the calcaneus, you're going to pull all that tissue away. Over here is a big bony aspect of the fifth metatarsal, your pinky toe. Comes down and has a much larger projection in its final aspect. And there's a tiny little bit of space between it and calcaneus where a few muscles and other things run. So if I apply pressure there, I'm getting those muscles as well as squeezing the heel. If I come around, just grab what people call the ball of the foot, but that's really just where the joint of the big toe is. And if I just push, pull here, I'm getting a lot all at once. I'm reinforcing the pliability of the arch of the foot. I'm mobilizing some stuff in relation to the big toe, which is really important. If you can apply like a little bit of traction. I'm also getting a lot of stuff related to the heel. And that just lends itself to a nice transition from here, heel squeeze, to heel squeeze. Now I'm over on the other side. Gathering the sheet. Da-da-da-da. Good. Here, contact, external rotation, internal rotation, forearm, gluteus maximus, this side feels like it has a little bit more stuff going on. So there's a touch more resistance as I go into this passive movement phase. As I go from this feels smooth, then suddenly there's a point of what just doesn't feel, now it's starting to get better. But there we go. Now I'm gonna just bring my arm down just a little bit more. Ends up being about this kind of an adaptation. I start here at about a 45-degree angle. I don't go fully vertical, just a little bit more. And that drops my elbow lower down, meaning it takes it more lateral, and that will get onto gluteus medius. So here for gluteus maximus, there for gluteus medius. And note with the motions at the hip, these do not have to be big. Like I don't just grab and go full crank in one direction. It's like real small to start, and then I'll slowly graduate those. And I try to keep them as rhythmic as possible. That way, even if I kept the pressure, lighter and more gentle, my goal was relaxation. I could still do this work similar to this right here and just have it more kind of a rhythmic compression plus joint movement dance quality. So like this will phase into a relaxation session just as well as anything. It's a matter of just making that joint movement as rhythmic and consistent as possible. But then even here, so let's say I was shifting and I was going for something much more specific, like piriformis related to sciatica. I might try to be really precisely on that particular muscle and then slowly challenge it to stretch. Because this is the action that actually lengthens all those deep lateral hip rotators. Lateral rotation, synonymous with medial or internal rotation. Sorry, medial rotation synonymous with internal rotation. Lateral rotation synonymous with external rotation. Okay. Knee flexion, knee extension. We're here, and I get everything nudged. I did it again. But before I put it on both hands, I can just contact and feel. You will start, going faster. As long as you don't apply too much lotion to start, you won't lose too much of that contact, but trying to break these things down so that you're actually paying attention to the skin texture and quality more precisely is my goal with that. But I'm just falling right into the habit of grabbing the lotion and going into these actions. So, here we go. Okay. So knees, warming everything up. Come over, turn into a glide. It's with the grain towards the hip. And across, trying to separate hamstrings from my T-band. Angle up towards the hip. Across. Pressure, turning into a glide, at an angle, across. On an angle, across. On an angle, and across. And good. Redrape. Feel. So here's where you would feel. There isn't a specific name for it. It's just like the protuberance of the, or they would call it the proximal, end of the fifth metatarsal. Find it odd that that doesn't have a more specific name, and everything else decides to. And then we're done in prone. I'm going to reset the sheets. Same contact points, but with like a little bit more momentum than what we started. So heels, knees, low back, mid back, low back, upper back, rock, rock, rock. Massage therapist voice, like, okay, we're going to get that bolster out and get you turned.